In this video, I'm going to introduce you to some global auto texts that we've added to eCare to help you document both completely and consistently the needs of patients identified as being at the end of their life. In this hypothetical example, we have a patient who's been admitted with lung cancer and bone metastases, and these are identified as this visit problems in their problem list. The patient also has a range of comorbidities which are identified as chronic problems. Now identified as being in the last few days of life, there are a number of interventions that need to be considered and documented against. Just like personal autotext, global autotext can be used anywhere in eCare where you would enter free text. The first autotext I'm going to introduce you to will begin /EOL. You could decide to use them in the template of any of the M pages, so progress notes, post-take notes, etc. Or if you prefer, you can use the autotext directly into the note that you're creating. Or finally, the autotext can be used in standalone clinical notes. As usual, you'd need to choose a note type and a name for your note. You can fire the global autotext either by typing the shortcut if you know it and can remember it. The ones we're using today all begin with a /EOL. And you can see the system has 4 available. There is a personalised care plan for the dying patient, day 1, day 2, day 3, and also a nursing 4-hourly care plan. Highlighting the one I require and pressing enter will fire the auto text. Alternatively, if I perhaps don't know the shortcut or I've forgotten it, right click followed by insert auto text will give me a list of all the available auto texts. And scrolling down, I can simply select the one I require, OK, and the auto text is fired. Now we'll maximise this window to get a better view. Here you can see the template. You can click anywhere where there's an underscore, as this is a suggestion that you may want to enter text here, but a quicker way would be to click the F3 button. That will take you to the first section that you need to document in. And pressing F3 again will take you to the next section. If you want to skip a section, simply click F3 again, etc. to scroll through the document. You'll notice that some of the questions, for example, under patient preferences, we have wishes regarding preferred place of death. Clicking on the arrow reveals a drop-down menu of answers. Simply select the most appropriate. At any point in the free text, you can add your own text, or delete sections if you think they're not appropriate. Once complete, sign your note as usual, and in this way we should develop much more consistent documentation. There's a similar shorter plan for day 2 and day 3, with the day 3 plan including instructions of what to do and a prompt to review the end-of-life pathway in general. Now, if we return to our patient's problem list, you may have heard of something called the Gold Standards Framework Indicators, which are in fairly widespread use in primary care, and we are now encouraging use within the trust. For our purposes, we are mainly interested in the red, yellow and green indicators, which indicate a patient in the last days of life, the last weeks of life, or the last year of life, respectively. These standards can be added to the patient's problem list. In this case, the suggestion is the patient is in the last few days of life, so we're looking for the red indicator. And we can add that to the patient's problem list, which of course will pull through to the discharge summary. As it's a this visit problem, it will also pull through to our assessment and plan. And to help you document against this, we've added some further global auto texts that align to each of the indicators. These can be accessed by typing /GSF, selecting the indicator you require, followed by enter. The auto text includes a summary of the aims of the framework for such a patient, along with a template to document against the actions, interventions and care instructions. Just as before, each of the sections can be accessed either clicking with a mouse or with use of the F3 key. Once you've completed this and create your note, you can see the templates pulled through. You'd then sign as normal. Finally, you may wish to prescribe anticipatory medications for your patient. And these can be accessed using the end of life medications care plan that has already been active in eCare for some time. Simply select the medications you want. Sign the plan. Complete missing details for the medication as you would for any prescription. Don't forget that as well as documenting your patient's resuscitation status on the purple form pathway, the outcome of that discussion, i.e. the resuscitation status, should also be set on eCare, and this is done using the resuscitation order. If you have any questions about anything in this video, please do not hesitate to contact the palliative care team for help.